good afternoon, rather. Seems like morning. After a few weeks of lying dormant, Trumpcare's back, and it's meaner than ever. While this latest version of Trumpcare may live under a new name, Graham-Cassidy, no matter how many ways Republicans try to dress it up, this bill is even more dangerous than its predecessors. Let me be clear. This is a red siren moment for the entire country. If this bill becomes law, our healthcare system will be dramatically curtailed, and there will be chaos in many states. Our healthcare system is again threatened by a hastily constructed piece of legislation put together in the back room by only one party, no CBO scores, no committee process, not a single public hearing. And while the process is bad, the policy is even worse. Let me explain. For starters, it rolls back protections for Americans with pre-existing conditions. We've had many of our colleagues, including one of the lead sponsors of this bill, say they will never support a proposal that doesn't protect people with pre-existing conditions. Well, here we are. And the lead sponsor and spokesperson of a bill that puts insurance companies back in control and could allow them to charge those with pre-existing conditions more or deny them coverage at all is pushing this bill. Pre-existing conditions is supported overwhelmingly by Democrats, Republicans, Independents. The heartache of a parent with a child seeking health care and can't get it because insurance companies can deny them because your kid has cancer or muscular dystrophy is something Americans have wanted to avoid. This bill brings it back. Brings it back. That is so wrong, so wrong. That's not all. It defunds Planned Parenthood, stripping millions of women of their right to access affordable health care. Women depend on health care services provided by Planned Parenthood, and in rural areas, in urban areas, in many places, would be gone, would be gone. And last, but certainly not least, the new Trumpcare would plunge a dagger deep into the heart of Medicaid, immediately ending Medicaid expansion, establishing a per capita cap on Medicaid spending. It jeopardizes coverage for 11 million Americans and puts at great risk the coverage and affordability of insurance for the 12 million who buy insurance in the marketplaces. Medicaid is supported broadly by the American people. It's not a partisan issue. It affects the poor and it affects the middle class. Young people with parents in nursing homes depend on Medicaid. Those who suffer from opioid addiction depend on Medicaid. This bill slashes it. And those people and so many others are going to be hurting so badly. The term block grants may sound harmless, but in practice, they're anything but. In the case of Graham-Cassidy, block grants are just a not-so-clever way of disguising a massive, massive cut to Medicaid funding and premium and cost-sharing assistance for those who buy insurance on the exchanges. According to the Center for Budget and Policy Priorities, whose numbers have always been respected, block grants would result in hundreds of millions and sometimes billions of dollars being cut from each state. Let me go over a few. Arizona would lose $1.6 billion in federal health care funding. Alaska would lose $255 million in federal funding. Maine would lose $115 million in federal funding. West Virginia would lose $554 million in federal funding. Colorado would lose $823 million in federal funding. Ohio, a state racked by the opioid epidemic, would lose over $2.5 billion in federal funding. Arkansas would lose over $1.1 billion. Iowa would lose $525 million. These are a few of the devastating numbers when you look at Trumpcare again. They represent millions of Americans. They're not just numbers. People, middle-class folks, poor folks, who will receive poorer health care or higher costs or both. They represent Medicaid-funded opioid programs. They represent nursing home patients. The bill is even worse than the previous version because these block grants it creates just disappear after 2026, leaving states and Americans with nothing to help them to get the funding or coverage they need. The idea, oh, they'll be renewed 10 years from now, just like CHIP, it's a much larger program. It's much harder to renew a program of hundreds of billions of dollars. It's not much of a promise. Now, the CBO has previously estimated that the repeal without replace approach would leave 32 million more people uninsured. That's why Republican governors like John Kasich and Charlie Baker have come out against it. That's why 16 provider groups, from the American Heart Association to the March of Dimes to the American Cancer Society, Cancer Action Network, released a statement today urging senators to oppose the bill. That's why the ratings agency, Fitch, said that Cassidy-Graham would be even more disruptive than all the other ACA bills. So now look, Republicans are going to try to convince each other from other states that the cuts won't be so bad. So let's wait and see what CBO says. I was told that one of the sponsors of the bill told one of the leading governors, don't worry, DISH will make up for the cuts in this bill. That's absurd. The amount of money in DISH is not close to the amount of money of cuts in this bill. So I would plead with my colleagues for the sake of honesty and truth and sunlight and their constituents, let's get a full CBO score before we rush headlong into this bill. Let's see how many people it'll hurt. Let's see how. Leader Pelosi, the top Democrats on the House and Senate Budget Committee, and I sent a letter to CBO asking for a full assessment of Graham-Cassidy so the public has a full understanding of the impact of this bill and its effect on working families. To do this in the dark of night, when it affects so many people and so many dollars, to not have hearings, to not have debate, to not have a full CBO score, is legislative malpractice of the highest order. It betrays everything this republic is all about. Plain and simple. I'll close by saying this. There's another way. To the Republicans, so many of them my good friends, who were frustrated with the divisive, destructive health care process that paralyzed the Senate for much of this year and resulted in nothing but failure, there's another option. We've begun on a path to bipartisanship. Don't destroy it by pushing Trumpcare again in the dark of night. There's another path, a path of bipartisanship that the American people yearn for. Don't destroy it by pushing this bill in the dark without people knowing what it's all about, without even talking to our side of the aisle. There's an alternative. Right now, Health Committee Chairman Lamar Alexander and Ranking Member Patty Murray are working in a bipartisan way with hearings in committee on a health care package that would stabilize and improve our system. It's the way things should work. Hearings, sunlight, bipartisan agreement, people coming together in the middle, each side getting something of what it wants. That's the kind of legislating Senator McCain was talking about. That's what we were sent by our constituents to do. That's what the Founding Fathers envisioned when they created this great republic. Let's not forsake all of that. Let's not forsake all of that to get a political scalp. Senator Schatz.
Thank you, Leader Schumer. Last week, our country hit a milestone. The number of Americans who do not have health insurance fell to a historic low of 8.8%. That means 9 in 10 Americans now have health insurance. But instead of celebrating this milestone, Republicans are trying to reverse all of the progress that we've made. Their latest version of Trumpcare is worse than any of the other versions of these bills. It is hard to believe, but this bill is worse. It will take health care coverage from millions of people, and Americans who don't lose their coverage will still get hurt with higher premiums or insurance plans that don't cover basic things like mental health, opioid addiction, or pregnancy. I want to be really clear about what this bill does to Medicaid. It trashes Medicaid. It destroys Medicaid as we know it. And let no one use the term block grant without a full understanding of what they're talking about. They are talking about giving a fixed amount to each state and reducing it over time and then eventually eliminating that grant to the state. That means opioid addiction, that means indigent medical care, that means nursing home beds. All of it will become a state responsibility. States will not be able to pay for this. This bill destroys Medicaid as we know it. It also destroys protections for those with pre-existing conditions. And this was the Jimmy Kimmel test, and this bill fails the Jimmy Kimmel test. And finally, this bill also makes all of the essential health benefits, all of the things that we have come to expect in a health plan, it makes it optional for each of the states. All of those essential health benefits, hospitalization, pregnancy, mental health, those have become a basic expectation across the country, and people have been helped by the establishment of these health benefits. And so this bill actually takes each piece of the Affordable Care Act and eviscerates it, and on top of all of that, it destroys Medicaid as we know it. As Leader Schumer said, there is another path, and Senator Alexander and Senator Murray appear to be on it, but this threatens to destroy the way the United States Senate works when it comes to one of the most contentious issues in the country, and this threatens to destroy tens of millions of people's health care.
We now have Bruce Leslie, President of First Focus.
Thank you, Senators. I just wanted to briefly talk about 4 things in the bill. So first of all, one of the things we were hoping we would be doing this week would be reauthorizing, extending the Children's Health Insurance Program. That would be a positive step for children. It covers 9 million kids in this country. But instead, what we're talking about is legislation, the Graham-Cassidy bill, that actually would harm kids in a number of ways. And so first I would point out is Medicaid. And so as both Senator Schumer and Senator Schatz talked about, Medicaid would impose a per cap, in this bill, they would impose a per capita cap on the Medicaid program. I would urge you to look at the growth rates in the program. They are far below the needs of kids. In fact, they disadvantage children. They actually, I would argue, pick on children and try to get the most savings in kids in the bill. And that's a problem. And then another example, and then in addition to that, they create this they basically wrap up all the funding in Obamacare and merge it all into a block grant. And that's a huge problem, and I would actually urge Senators Graham and Cassidy to really rethink that, because what that means is there's not enough funding in the bill if an emergency happens. You get a set amount of money that would be established today, and if in the future we're having these series of hurricanes, for example, if in the future the hurricane hit one of their states, and they seem to be 2 states that are often hit, they would receive no additional funding. So they would have this huge increase in need. And I used to work for Senator Bob Graham here in the Senate right after in the aftermath of Hurricane Andrew. And it was a disaster. There was an enormous increase in healthcare needs, and yet under this bill today, there would be no additional federal response under this enormous block grant. The block grant also amends the CHIP bill, which is fairly ironic since what needs to happen this week is CHIP. And then last, they both talked about the important issues around pre-existing conditions, and the bill definitely guts issues around pre-existing conditions to the point where we actually are concerned that a family who has a newborn would actually potentially be allowed to be denied insurance coverage based upon a pre-existing condition at birth. So those kinds of things, this would be a huge taking steps back, and so we stand with the senators here and urge the defeat of the bill and have people go back to the drawing board and look for a bipartisan solution.
Thank you. We now have Elena Hung of Little Lobbyists, co-founder.
Thank you. Thank you, Leader Schumer, Senator. Hi, everyone. Thank you for being here. My name's Elena Hung, and I am a mom. And I am here today because I am absolutely terrified of the possibility that Graham-Cassidy healthcare bill could become law. 3 years ago, I had a great pregnancy and an amazing birth. I was thrilled to meet my baby girl, and then 15 minutes after she was born, she required 100% oxygen support and was rushed to the NICU, where she remained for the next 5 months. During that time, she was diagnosed with multiple serious health issues affecting her airway, lungs, heart, and kidneys, resulting in 3 major surgeries, countless medical procedures, and consultations with over a dozen specialists. Today, my daughter Xiomara depends on a tracheostomy to breathe, a ventilator and supplemental oxygen for additional support, and a feeding tube for all of her nutrition. Today, also, she's in school because she had access to excellent health care. Now, 3 years ago, I was thrust into the world of parenting a child with complex medical needs, and I took a crash course on how to advocate for my baby, and I've been advocating for her ever since. Plans to repeal the ACA and cut and cap Medicaid directly impact my family and families like mine. This summer, in response to the efforts to repeal the ACA and all the protections it affords, my friend Michelle and I decided to take our kids to Capitol Hill so that senators could see the faces of those who would be affected by their votes on health care. We wanted them to know our kids and see that kids with trachs and ventilators and feeding tubes and rare syndromes and medical records a mile long are just kids. They're kids who need health care. They are kids who can thrive with proper medical care, and like my daughter, they can go to school, they can go to playground,
Carry a book bag.
they can carry a book bag, they can go to story time at the library, they can live at home with their family, watch Sesame Street with their sibling, they can come to a press conference like this, and just be a kid, be a kid. So we asked families like ours across the country to share their stories, and we offered to hand deliver them to their senators. And share they did. And hand deliver we did. This summer, 16 families came to the Hill on behalf of our group, the Little Lobbyists, some of whom are here today. We brought our children with us every single time, with their medical equipment and emergency bags in tow. From that first day in mid-June to the day the skinny repeal bill was defeated, we had collected over 225 stories from families in 46 states, all families like ours, families with children with complex medical needs. We spent day after day, week after week on Capitol Hill. We visited all 100 Senate offices, some offices multiple times. We had meetings with staffers from 33 Senate offices, both Republicans and Democrats. We met with 20 US senators. And we did all of that because we desperately needed to tell our stories. We desperately needed the members of Congress to see our children and understand what was at stake for us. This is our story. Our children deserve a childhood. Our children deserve to grow up. My daughter Xiomara has come so far since those days in the NICU, since those 169 days in the NICU. And she has worked so hard on her therapies to accomplish things that once seemed impossible. And today she's a happy child who's going to school and thriving because of the medical care she received. Medical care that does not put a cap on her life. Medical care that does not discriminate against her pre-existing conditions. 10 pre-existing conditions that she was born with. Medical care that allows my daughter to receive the care she needs at home and in the community, and not in an institution. Medical care that does not force families like mine into bankruptcy. And that is what medical care is. Now, we all agree that our healthcare system needs fixing, but taking away protections from children with complex medical needs is not the way to fix healthcare. Taking away medical care from children with disabilities is not the way to fix healthcare. And that is what this bill does. That is what Graham-Cassidy bill does. It doesn't give flexibility to families. It doesn't give us a choice. It cuts Medicaid funding that our children desperately depend on. It rolls back protections for our children. Our children with complex medical needs all have pre-existing conditions. And that is absolutely terrifying for my family, for the families here with me, for the little lobbyists, for the hundreds of thousands of families across this country. No, you can't call yourself pro-life when you're playing politics with our children's lives. You can't. So stop playing politics with our children's lives. Stop playing politics with my daughter's life. Please listen to our stories. Please get to know our kids. And I ask you, as a mom, to please protect their health care. Thank you.
We next have Sean Martin of the American Academy of Family Physicians. Then we'll have Niles Godis, Senior VP of Leading Age, and then we'll answer questions.
Thank you, Senators. On behalf of the American Academy of Family Physicians and the 129,000 members that we represent, we're here today to express our sincere and strong concerns about the Graham-Cassidy bill, largely for the reasons that you've already heard that I can't articulate any better than have already been stated. But I would make one point. Our members spend every day in an exam room with a patient, and they understand the difference in having healthcare coverage and not having healthcare coverage, not just for the health, but for the financial health of that individual and the family. Not having healthcare coverage is a financial anchor hung around a number of families in this country. And the choices that they must make as a result of uncertainty in the healthcare marketplace are real. And it impacts the choices they make, not just for healthcare for themselves, but also for their family. And I would close with this. We're approaching the end of our 9th month in Washington, D.C. of trying to take something away from tens of millions of people. The Academy calls on the Senate to pivot to bipartisan solutions where we can begin to improve the healthcare system for people, not take the healthcare system away from millions of people across this country. So thank you all.
Thank you. Niles.
Yes. Thank you, Senators. Good afternoon, everyone. My name is Niles Godis, and I'm Senior Vice President of Leading Age. On behalf of Leading Age and older adults across America, I'm here today to oppose the Graham-Cassidy bill. The mission of Leading Age is to be the trusted voice for aging in America. Our members are nonprofit aging services providers caring for older adults and people with disabilities in communities across the country. We oppose converting Medicaid to a per capita cap or block grants, as Graham-Cassidy would do, because this would threaten the security of millions of people who count on this program in their later years. Per capita caps and block grants would so radically restructure Medicaid that it would be unrecognizable from its current form. Per capita caps and block grants would cut Medicaid deeply precisely when it is needed the most. Aging baby boomers will need aging services more than ever, just as Medicaid is being cut. Medicaid has become the default payer for long-term services and supports because there are no significant alternative sources of payment other than out-of-pocket. As of 2013, more than 1/3 of all Medicaid spending went toward long-term services and supports. People in need of long-term care are often the oldest and the frailest among us, many with complex health conditions. They have few options and very few can afford to pay for these services on their own. Medicaid is essential to enabling them to live out their later years with dignity and support. We urge senators to oppose Graham-Cassidy. It is bad for older adults and it is bad for America.
Thank you, Niles. One other point I want to make before questions. We've just been told that CBO, the only thing they can do this week is one top line which says whether this bill meets the reconciliation. They will not be able to measure the effects of this bill on people. How many people will lose coverage? How many people will lose services? What services are likely to be lost? That will take another week or two. It would be outrageous for our Republican colleagues to vote for this bill without knowing its effect on people. That, whatever your ideology, would be nothing short of a disgrace. Okay, questions for Brian, myself, or any of the panelists?
Are you concerned if this plan by Cassidy and Graham gets momentum and they try to move this before the reconciliation window expires? Obviously, the vote count is pretty tight, or you wouldn't be holding this.
Yes.
About the possibility of Senator Menendez being absent, and that could possibly impede this.
My guess is Senator Menendez would be here if needed.
From a process standpoint, does this concern you more than previous repeal?
Yes.
Given that it's a grassroots effort from the bottom and not something that Leader McConnell was advocating or pushing?
Oh, I don't know what difference that makes. It's how it affects people. This bill has had shorter time to be exposed. We'll get a CBO, will not get a CBO score. It's being just rushed through at the very last minute. And I know why. They're afraid of fully examining this bill. If they were proud of this bill, they wouldn't rush it through in the dark of night. They'd wait for a CBO score. So this is just, as I say, legislative malpractice of the highest order. This process would make the Founding Fathers just turn over in their graves. This is not what America, this is not what Congress is supposed to be.
To that end, are there steps that Democrats can take to slow this process down? Will you take those steps? And on that same idea, you were in contact with John McCain quite a bit before the last vote. He's expressed concerns about the process on this one too, although his governor now says he supports it. Is that a conversation you'll continue with him specifically?
Well, I talk to Senator McCain on a regular basis on issue after issue, and I'm sure that will continue.
But on the question
Yes.
of steps you can take, Senator?
On the question of steps, look, this is so outrageous and so harmful that we're going to look at every possible way to slow this bill down, absolutely. We're going to explore every single option. You know, this bill was not even a thought to come up a week ago. Now it is, and we will look at every single available option. Cheryl?
Following up on the McCain question, can you say specifically if you've talked to him about this bill and asked him if
I keep my conversations with Senator McCain between him and me. Yes?
Did you talk to the parliamentarian or CBO initially about the reconciliation rules?
Well, the parliamentarian has issued her version of her view of the reconciliation rules, and those stand. September 30th is the deadline. But this CBO, we sent this letter to CBO this morning, and clearly on a bill like this, which just says, let's see what the states do, CBO needs some time to explore its consequences. To not even know how much Medicaid will be cut, how many people will lose coverage, and then vote for this bill? Okay, thank you, everybody. Thank you so much. Appreciate it. Thank you all for being here.